So now moving on to UTI, there will be lower abdominal pain, dysuria, fever, increased frequency of micturition and all. And in acute pyelonephritis, this is mainly caused by E. coli. There will be ascending UTI and the onset is very rapid. There will be normal symptoms like frequency, urgency and flank pain and all. And if there is pain in the loin, it's an indication that the infection has ascended. And the diagnosis by urine culture and empirical antibiotics will be given. And the risk factors, there will be like structural renal abnormalities including vesicoureteral reflex, calculi, urinary tract catheterization, stents, pregnancy, diabetes mellitus, neurogenic bladder, prostate enlargement. And in chronic pyelonephritis, there will be no active infection will be there, but due to repeated UTI, there will be scarring in the kidney. Along with that, there will be hypertension and the size of the kidney will be very small. There will be no fever as there is no active infection. Okay. And now about the indications for hemodialysis, mainly anuria, severe hyperkalemia more than 6.5, pulmonary edema, severe metabolic acidosis and uremic encephalopathy. And peritoneal dialysis, the omentum filters. It is of low cost and can be done at home. Peritoneal dialysis is good for cardiac patients. And now Alport syndrome. Alport syndrome is inherited. It affects the glomerular basement membrane, cochlea and the lens of the eye. And the clinical features include cataract, deafness and hematuria. And there's a mnemonic for the indication for dialysis: AEIOU, acidosis, electrolyte imbalance, ingested toxins, overdose of drugs and uremia. And now urinary stones. Causes include mainly dehydration, hypercalcemia, gout and polycystic kidney disease. So the indication for dialysis mainly AEIOU, acidosis, electrolyte imbalance, ingested toxins, overdose of drugs and uremia. And the urinary stones, the causes dehydration, hypercalcemia, gout and polycystic kidney disease. And the symptoms of renal stones mainly include sudden loin pain radiating to the groins, nausea, vomiting, fever, hematuria. And if it is less than 0.5 centimeter, advise increased fluid intake. And if it is in between 0.5 to 2, extracorporeal shockwave lithotripsy should be done. And if it is more than 2 centimeter, percutaneous nephrolithotomy should be done. And about the types of stones and all, I think I mentioned in the question paper section. Please check. Now about CA bladder, the risk factors include smoking and increased age and exposure to paint, dye, rubber, chimney sweep and all. And in elderly patients greater than 50 years and with hematuria means you have to check for CA bladder. And the cell type is transitional cell CA. And investigation is mainly done by cystoscopy. And testicular cancer is seen like 20 to 25 years, like seminoma. It is presented as the painless lump within the testis. Undescended or maldescended testis are risk factors for this. And the investigation is mainly done by USG. So CA bladder, the risk factors include smoking, increased age, exposure to paint, dye, rubber, chimney sweep and all. And in elderly patients more than 50 years with hematuria, you have to check for CA bladder. And what is the cell type? Transitional cell CA, and investigation is mainly by cystoscopy. And testicular CA, 20 to 25 years old, like seminoma, like painless lump will be seen within the testis. And risk factors include undescended or maldescended testis. And investigation is by USG. In testicular CA, we can see increased LDH. And the prostate cancer is the most common in males. It increases with age and obesity is a risk factor. And the clinical features for prostate CA like includes hematuria, urinary retention, nocturia, incomplete voiding, weight loss and all. Okay. And it is confirmed by digital examination. Prostate CA is confirmed by digital examination. And the findings on digital examination include irregular heart nodules. Okay. Irregular heart nodules can be seen and prostate specific antigen increases. Okay. In testicular CA, LDH increases and in prostate CA, PSA increases. And the on examination, irregular heart nodules can be seen. It is most common in cancer in the males. It increases with age and obesity is also a risk factor. Okay. Next, epididymocarditis and testicular torsion. Acute epididymocarditis is an infection and testicular torsion is an emergency condition and surgery should be done or else it will lead to gangrene. Now about Pren sign, that is tenderness decreases on elevating the scrotum. It is seen in like in epididymitis and all, it is seen. And in testicular torsion, the pain is severe and sudden and it is mainly due to trauma seen in young males. And pain is not eased by elevation of the scrotum, and the treatment is mainly surgery. In epididymocarditis, it is mainly due to infection. There will be unilateral pain and swelling, fever, rigors, and mainly the local spread of infection from GI tract, then infections like chlamydia, E. coli and all. Okay, so what is front sign? The tenderness decreases on elevating the scrotum. It is seen in epididymitis and all. Okay, now benign prostatic hypertrophy. Like BPH is seen in mainly old men with voiding symptoms like urgency, frequency and all. Like incomplete dribbling will be the emptying and dribbling of urine will be there. Okay, and here on the digital examination the prostate will be enlarged smooth, and for CA prostate we studied that it will be nodular. Here it is enlarged and smooth prostate on digital examination. Okay, and the management includes watchful waiting, alpha blockers and all, and then for surgery should be done as the last resort, and it is transurethral resection of the prostate. Now the scrotal swelling, there is painless swellings and painful swellings. Painless swellings include mainly testicular CA, epididymal cyst and hydrocele. And the painful swelling include acute epididymocarditis, testicular torsion, varicocele. Varicocele, as you all know, the dilated papilliform plexus or the bluish scrotum. Okay. Thank you.